why is this important? It's important to determine relevant data. And we talked in day 2 what relevant data is the most important. So it helps you understand the relevant data. Once you know what is really important or relevant, then you will be able to start formulating the next course of action. So a good tip about analyzing cues is analyzing cues and determining what relevant client data means leads to formulating client needs, prioritization of care, planning care, clinical decision, etc. What this means is if you do not begin with a good step, with a good foundation, you're going to be thrown off and everything else will be answered incorrectly. Especially if on the Next Generation NCLEX, you're dealing with a case study. Case study, they provide so much information that you really need to develop the ability to identify what is important and what is nonsense. I hope that makes sense and you're seeing these scenarios differently. And I tell you, the more you practice, the better you're going to get at it. Now, in which type of questions you will be using this analyzing cues strategy? You will be using it in multiple choice questions, in drop-down questions, multiple response, select or apply, select ends, and drag and drop items. In all these questions, you're going to be able to use the analyze cues strategy. Now, we're going to focus in today's training on this type of questions, the multiple choice single response and the matrix multiple response. Remember that yesterday we covered multiple response select and multiple response select or apply, and we also covered the highlight style of questions. Okay? So what is the multiple choice single response item on the Next Generation NCLEX? The format for the multiple choice single response test is very similar to what you know in today's NCLEX. It's very similar. However, the clinical scenario, the information that they're going to be giving you is going to be longer, more detailed, more distractors also thrown at you. And also, in addition to the clinical scenario being longer or more detailed, the number of responses will not be restricted to 4 options. You know, as before we used to, or in the NCLEX now, you see the stem of the question, 4 answers, and you have to identify what is the correct answer. Well, in these multiple choice single response item, you can have up to 10 options included. Wow. So you have to pick the correct answer, not out of 4, out of 10. So imagine, do you need to be more clear on how to analyze the question? Do you really need to pinpoint what is the most priority nursing action? So now more than ever, your clinical judgment, your critical thinking, and your ability to analyze and use NCLEX strategy is going to be needed more than ever.